Morning, Dr. Patino here at the Cosmetic Surgical Center of Los Cerritos. So we're gonna do power assisted. See, this is power assisted. It's like a toothbrush, but it's an electric toothbrush. See, it vibrates, and so you're gonna be the first ones to see what happens when we put the cannula in here and what's gonna come out of this cannula. Okay, so now we're aspirating the fat, nice and gentle. Look how my motions are very, very calculated, very nice and gentle. I'm not jamming the instrument back and forth like an old toothbrush, right? So I'm just going with an electric toothbrush. You just let it do its work, right? And look what's coming out, right? Yellow, beautiful fat, right? The same thing if you brush your teeth, even if you have a brand new electric toothbrush, but you go at it like if it was an old brush at full speed, there is going to be gum bleeding. And here is no different, right? So the fact that the surgeon has a sophisticated piece of equipment like we do, the microwave power assisted liposuction, doesn't mean the surgeon is going to use it properly, right? Because the surgeon may just use it like an old or traditional liposuction instrument, and there will be a lot of bleeding. And so my strokes are very calculated, very slow. And this is how I'm very meticulous to the point of being ridiculous. And this is how you get this type of aspirate, right? Is it completely bloodless, Wendy?
Completely bloodless. Actually, it's golden.
Golden fat.
The liquid gold.
This is what we're known for, and this is very important because we want to obtain this oil-less, meaning without oil. Because why there's no oil? Because we go slow and we don't traumatize the tissue, because we use soft, small cannulas. That yes, it takes me longer to do this, but I am being more careful with the adipocyte or the fat cell so we don't destroy it, right? So that oil that leaks out of the fat cell is like the fat cell is crying. Hey, you hurting me, it's crying. And of course, if you transfer oil into the buttocks, what's going to happen is that you get an oil cyst, right? And the body creates a capsule around it and pushes it out. The same way, if you put blood into the buttocks, the blood is an irritant to the tissues when it's not where it's supposed to be. It's supposed to be inside the blood vessels. When it's outside the blood vessels, I believe that the blood irritates the tissues and the tissues create a reaction. This is very similar to what happens in the breast. If you do your regular traditional breast augmentation technique, there is going to be bleeding. And the blood, it doesn't have to be like a lot of blood where there is a blood transfusion and a hematoma and all that. It just needs to be a little bit of blood around that breast implant, and so then the body creates a reaction. It's called a capsular contracture, and then the implants become very hard. And then you may need to change them or do another surgery. And so when we do the breast augmentation, and of course we do it through the belly button, the risk of bleeding is near zero. The risk of infection is near zero. Those are the main causes of capsular contracture, and as a result, the risk of capsular contracture is near zero. This is just an analogy, but it's similar to what happens in the buttocks. See, if I put blood in there, there's going to be a capsule around it, and the body's going to want to push it out, right? And it creates a deformity in the buttocks, right? So now, how do you get this aspirate, right? What is the secret, right? And there's no secret here. We teach other doctors, so I'm very generous with my knowledge. But the most important thing is the technique. How to do this in a very calm manner, relaxing. I'm not sweating it. I'm not putting a lot of effort. Look, I'm just using my fingers there. So it's very, very simple surgery. That's number one. To drive slowly, right? To go slow. That's number one. And when you're driving, that's the number one. Of course, you got to know how to drive, right? You have a license and that sort of thing. And so, you have to be trained and all that. But basically, we're assuming all of that. But the number one is the speed. So go slow. Okay. Number two, use non-aggressive cannulas, right? These can be done very, very big, but we use very tiny cannulas, millimetric, like the biggest cannula is 4 millimeters, right? Some doctors use 6 and even 8 millimeter cannulas, and even larger, and are very aggressive cannulas. So no, we don't do any of that, right? And then, see, I'm gonna switch hands here, but I'm very, very relaxed, right? And so, then, probably, what the patient does is extremely important, right? So, we ask the patient not to take any aspirin-like medications, no ibuprofen, no vitamins of any kind for 2 weeks before and 2 weeks after the procedure. Some doctors give the patient vitamins, they give the patient aspirin, they give the patient ibuprofen. Well, of course, you're not going to have a result like this. Impossible. Impossible. You're not going to have an aspirin like this. There's going to be bleeding, right? And some doctors also give enoxaparin and heparin and blood thinner-like medications, right? Well, patient is not going to know. The reason why a lot of doctors prescribe these blood thinners is because they don't want the patient to have a blood clot, which is the most lethal complication during these procedures, and that's what can cause death. And thanks to that, we never had anybody die. And they mainly do that because their patients are in severe pain; they're not going to move, and so they have to depend on a blood thinner to take care of them. Thank you. I believe that the best way to prevent a blood clot is not enoxaparin, it's not blood thinners, but it's early ambulation. So our patients walk 1 mile the first day, 2 miles the second day, 3 miles the third day, preventing a blood clot. Thank you. Wow, so look at this aspirated, it's absolutely yellow, bloodless, absolutely oilless and bloodless and yellow, beautiful, gold-like aspirate. It's almost like white, you guys. There's absolutely not even a speck of blood in there. And I want you to follow that up to the canister so you can see how beautiful this is. You're gonna let me know when, and I'll let it go, so that you can see how that yellow fat that we're getting in very meticulously, very carefully, is gonna go into a pool of saline, right? So that's another thing that we do. We're very careful so that the fat cells, as they're aspirated, they don't go and hit that hard surface, but instead they go into a pool. 1, 2, 3. So it's not going into an empty pool, but it's going into a nice pool full of water. Thank you. Wow, so look how we're doing this. We're collecting this bloodless and oilless fat graft. Very, very comfortable here at the Cosmetic Surgical Center of Costa Rica. We're going to show you something different, something that we haven't shown before. It's another thing that we do to protect the fat cell. The fat cell is not going to go into an empty pool and crush against the walls, the hard walls of an empty pool. It's going to go into a pool full of water. So that water is normal saline. We put about 500 ml of normal saline so that the fat cell doesn't crush and gets destroyed as it hits the hard glass, sterile glass of the container. And we do all of these in a closed system. So no exposure of the fat to air or any ambient. It stays all very sterile, much less risk of contamination, much less risk of infection. I'm going to let it go on the count of 3.
Not
1,
yet,
2.
doctor. Not yet.
Not yet.
Let's keep it coming. Let's keep
I can let it
collecting
go
more
right now.
fat.
I can let it go right now. 1, 2, 3. You're going to see how it goes. Boom,
Alrighty.
boom, 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 boom. You see that?
Oh.
Yeah, that's what I mean. That's what I'm talking about.
All right.
Incredible, incredible. Very nice. Thank you. Another thing that's very important here is our anesthesia providers, right? We partner with Sedation Anesthesia. We recommend them highly. It's a group of 15 very extremely qualified anesthesia providers that take care of our patients, right? And what happens is that it's an integrated approach to the care of the patient. We discuss the patient. They're very aware of the patient's history and everything. And so we minimize risk by doing that. and the patient's blood pressure is maintained, the hemodynamics are maintained. In other words, the blood pressure is maintained within a normal range, right? Because if I can do all these perfectly, right, but the blood pressure is out of control, right, then the patient is going to bleed, right? So we have to make sure that also we select our patients appropriately. If you have high blood pressure, then we want to make sure that your blood pressure is well controlled prior to the procedure, and it stays controlled intraoperatively. There's some medications that need to be stopped. So we do 3 physical exams. So that's all very important. 1, 2, 3, go. Incredible. Thank you. Okay, so we're done. She's on her side. Buttocks over here. Notice the nice waist that we've given her. And I'm going to do what is called the pinch test. See? You see that? There is absolutely no excess fat here at the Cosmetic Surgical Center of Osarito, you know? So everywhere we go, there is no excess fat. We can even do it this way, you know? See? No excess fat. I don't know if that's easier for you. See? No excess fat at all here. Nice waist. She looks incredible. Thank you. So with the traditional technique, a lot of doctors use this technique and they don't put lidocaine at all, 0, okay? And what happens if you don't put lidocaine, which is an amen medicine, that the patient is going to be stimulated during surgery, and the blood pressure is going to go up. The pressure is going to go up, then they're going to bleed. You're not going to have this beautiful yellow fat, no way, right? Because the blood pressure goes up as the patient is stimulated. Now, post-operatively, after surgery, the patient is going to be in severe pain. So the patient is not going to walk. The patient is not going to walk. The patient may get a blood clot. The patient get a blood clot. The patient may die, right? We never had anybody die. We want to keep it that way. And of course, the patient is going to be anticoagulated, meaning the surgeon is going to give him blood thinners. Why? Because if the patient is not walking, that's a setup for a blood clot. And of course, the patient is going to receive anticoagulants in the form of heparin or enoxaparin, right? Or aspirin and or all of them, right? Together, right? So that's very important. So, but our patients are the opposite. We put plenty of tumescent anesthesia, plenty of numbing medicine here, so that the patient is not stimulated during surgery, so the blood pressure is maintained and it doesn't go up, it's maintained within a normal range, and then the patient doesn't bleed, and you can have, toward the end of surgery, or almost here, a very beautiful yellow aspirated, bloodless and oilless, because we respect the blood cells, we don't traumatize it. So this is just unbelievable, the way how we do surgery here. And of course the patient, and so it also allows me to go very slow, very nicely. So, right, so again, buttocks over here, see sideways, and this is what we call the pinch test, see? Absolutely no excess fat here. We're about 0.5 centimeter on the pinch test. This is part of the surgery. We can do it this way too. I don't know what's best for you, but notice how this is her waist. Look at that, nice waist. Instead of being like that, it's like this. And look at this, see? Absolutely no excess anywhere you go, see? Out to the marked line. The belly's on this side. We're not doing the belly on her today anyways, but just want you to see the pinch test. Thank you. Wow, so look how we define the paravertebral muscles on this patient. So she looks very athletic. So there's high definition in the back also. And look at this, we made her very athletic. See, like that. When she stands up, it's gonna be like that. Very nice, thank you. Okay, so this is ultrasound guided gluteal fat transfer. So look at the bloodless, oilless fat graft. It's exactly how we took it out. We haven't processed this in any way whatsoever, other than it was collected in 500 ml of saline like you saw. But it is a pure fat graft incredible. And so I'm looking at what's going in, okay? I'm looking at the patient, and I'm looking at the ultrasound to make sure that we go in the deep subcutaneous space according to the ultrasound guided gluteal fat transfer guidelines by the World Association of Gluteal Surgeons. And now we're going to move to the other side. And what I do when I move to the other side is I move places, okay? And we'll show you. Thank you. Alrighty, so now the same thing on the other buttocks. So we usually put 100 on each side. And again, I'm looking at the ultrasound. I'm looking at what's going in, which is that, what I promised you, right? It's that bloodless, oilless fat graft that has not been treated in any way. So we haven't processed this fat to clean it in any way, because guess what? It was clean to begin with, right? We don't need to do that, right? And this is cleaner fat than any commercially available fat cleaning system, right? Because it is pure fat to begin with. And we're going here in the lateral compartment,
100.
and we've got 100, and so now we're gonna move. Thank you.
All right, so here is the ultrasound Dr. Patino is using as he is going to put the fat into the buttocks. Right here you can see the skin, and the superficial gluteal fascia is right there. His cannula is in the deep subcutaneous space.
Yeah, I'm wiggling it for you.
Wiggling it. And then here is the deep gluteal fascia, and that is protecting the striated muscle below it.
Very good. And so now I'm going to go ahead and start a bolus. You're going to see a point to the tip of that cannula. You're going to see a great cloud.
And you
As the fat enters the space.
moving the muscles down as the fat is coming into the space.
Awesome.
Thank you. Okay, so now this is the other buttocks, and we're showing you again the skin right here. The superficial gluteal fascia is right there. This is Dr. Patino's cannula, and he's wiggling it. The deep gluteal fascia is right there, and below is the striated muscle. So he is going to again put some fat here in the deep subcutaneous space, and it will leave a gray cloud and push the muscles down as it enters the space.
Very good. So pay attention to that cloud right there. 1, 2, 3.
And as it goes up, this moves down, creating a bigger space in the subcutaneous area there.